Alright, stimulants. Stimulants excite neural activity and speed up body functions. These include caffeine, nicotine, amphetamines, cocaine, and ecstasy. Nicotine is stimulating and highly addictive. It's the psychoactive drug in tobacco. It arouses the brain to an increased state of alertness, reduces circulation to the extremities, increases heart rate and blood pressure, suppresses your appetite for carbohydrates, and at high levels it can even relax muscles and trigger the release of neurotransmitters that seem to reduce stress. This seems to be why that some people say that smoking makes them feel less stressed. Alright, cocaine. Cocaine actually works in the synapses between neurotransmitters. What it does is it blocks the reuptake of neurotransmitters. So you can see the cocaine is the red squares. It binds to sites that normally reabsorb neurotransmitter molecules. So it blocks the reuptake of dopamine, norepinephrine, and serotonin. These extra neurotransmitter molecules remain in the synapse and intensify their normal mood-altering effects, producing a euphoric rush. However, when the cocaine level drops, these neurotransmitters are gone, and that absence produces a crash. Methamphetamine is a powerfully addictive drug, probably one of the most addictive drugs out there. It triggers a release of dopamine, which enhances energy and mood. The after effects include irritability, insomnia, high blood pressure, seizures, periods of disorientation, and even violent behavior. The big thing about meth is over time it can permanently reduce the brain's normal dopamine output, leading to craving for more meth. So dopamine, of course, is one of those mood neurotransmitters. It's very important. When you can't produce it, it affects your ability to feel happiness. So it's very important that they're not damaged, because long-term damage, this is permanent damage. So if you try to come off of methamphetamine, this is why so many people have such difficulty, because they never feel normal again. They lack the neurotransmitters to even get back to normal. And this may take time, but actually meth starts destroying those transmitters immediately. So this is not something that you want to just play around or experiment with. Ecstasy is a similar stimulant. It instead though works on the serotonin producing neurons. So that affects, of course, serotonin leads to not enough serotonin leads to depression. So while it increases those the serotonin in the system temporarily, in the long term it harms those serotonin producing neurons, leading to a depression from the drug itself. So that you need the drug to be able to feel even normal, and more of it to feel an actual high. So it's, again, something that's not something that you want to experiment or mess around with. Hallucinogens are psychedelic drugs that distort perceptions and evoke sensory images without sensory input. Probably the most well known is LSD, which is a powerful hallucinogen. It interferes with serotonin transmission. We also have hallucinations in near-death experiences, which include altered state of consciousness that's reported after a close brush with death, and these we think may be similar to drug-induced hallucinations. Marijuana. Marijuana is a difficult drug to classify. The effects include mild hallucinations, increased sensitivity to colors, sounds, tastes, and smells. It also relaxes, disinhibits, and produces euphoria. It impairs motor coordination, perceptual skills, and reaction time. It can also help control pain, which is why we have medical marijuana use as something that's happening now. It also reduces the ability to sense that hunger is satisfied, aka the munchies. Unlike alcohol, however, THC lingers for a month or so, during which it takes smaller amounts of THC to trigger the effects. This is also why it can be picked up on a drug test so long after you have used it. Here is a list of the psychoactive drugs, their type, their pleasurable effects, and then the negative after effects as well. And this chart, of course, is in your book. Here's rates of substance abuse over time, looking from 1975 through 2009. As you can see, alcohol abuse among teenagers has declined by almost 20%. Marijuana declined, but then has been climbing slightly in the more recent years as its use has become more socially acceptable. And cocaine had a spike in the 80s and then has pretty much declined since then. Or I guess stayed stable because they don't really use it compared to the other two. Understanding substance abuse, there seems to be biological influences. Adopted people are more likely to have alcohol dependence if a biological parent was an alcoholic, not their adopted parents. Identical twins have correlated alcohol dependence. Boys at age 6 who are excitable and fearless are more likely as teens to smoke, drink, and abuse other drugs. Researchers have also bred rats and mice that prefer alcoholic drinks to water, so there very much seems to be a strong biological component to the propensity to abuse substances. Understanding substance abuse, we have psychological and sociocultural influences as well. Things that your friends do, peer pressure makes it more likely for you to do things, and this includes good and bad things. If your friends exercise, you're much more likely to exercise. However, if your friends drink or smoke, you're also much more likely to drink or smoke. Substance abusers may have experienced significant stress or failure and depression, so some people use it as a coping mechanism, but it can also have societal roots. Contributions from media and culture. Seeing people on TV smoke and drink makes you more likely to smoke and drink. And location matters. There's more opportunities and less supervision in cities, and then also the peer pressure as we discussed. Alright, mood disorders. These are psychological disorders characterized by a prolonged state of emotional extremes. These include major depressive disorder, mania, and bipolar disorder. Mood disorder, anxiety is a response to threat of future loss. A depressed mood is often a response to past and current loss. And we all feel depressed or anxious sometimes. That's normal. When it's a mood disorder, it lasts longer, and it sticks around even when there's not something to be depressed about, and it makes it hard to function. Seasonal affective disorder is a recurring depression during the dark months of winter. This is a question, have you cried today? You can see the numbers for men and women in August are much lower than they are in December. There's about a 4% increase for men and a 14% increase for women. So this seems to affect women more than men. They actually treat this with exposure to light therapy. So they put light that has UV radiation, which is good for vitamin D production, so they think it may have something to do with that, or just the fact that we need a certain amount of sunlight to be healthy for lots of reasons. Depression and evolution. Biologically, life's purpose is survival and reproduction, not happiness. Depression can help us face and solve problems. It protects us from dangerous thoughts and feelings, and gives us time to think and consider our options in the face of trouble. Because when you get depressed, you tend to ruminate, which means to think about something, rather than rush off and just do something. Major depressive disorder. A person with major depressive disorder experiences 2 or more weeks of significantly depressed moods. This includes lethargy, which is extreme tiredness, a feeling of worthlessness, a loss of interest in family, friends, and activities they used to enjoy. This is actually the leading cause of disability worldwide. And as people become so depressed, they don't even get out of the bed for days. They're unable to work or even sometimes hardly take care of themselves. A person with bipolar disorder alternates between depression and mania. This is much more extreme and problematic than simple mood swings. And people that claim to be bipolar, when they haven't been diagnosed by a psychiatrist and a psychologist, really do a disservice to people who actually suffer from bipolar disorder, because it seems to have made its way into pop culture as a way to kind of get away with basically being a jerk. You want to be moody, and you blame it on bipolar, and you don't have a diagnosis, and it makes people who actually have bipolar and struggle with this have a difficult time having people take them seriously. During mania, people are over-talkative, overactive, and elated. They sleep less. Sexually, they're uninhibited, and they're easily irritated. They have extreme optimism and self-esteem. Some of them will stay up till 3, 4 in the morning doing something, sleep for a few hours, get up at 6 and stay up all day again. So that's very unhealthy for them and hard on their bodies. In milder forms, mania's energy and free-flowing thinking can actually fuel creative energy. A lot of creative minds actually suffer from bipolar disorder. These include Madonna, Mark Twain, Virginia Woolf, Tim Burton. Tim Burton, a lot of his material from his movies comes out of his depressive periods, and then he tends to make movies during his manic periods using that material. Suicide. Nearly 1 million suicides a year worldwide. The risk is 5 times greater for those who have been depressed. People may feel most suicidal in the depths of depression, but have a lack of initiative and energy to actually act on it. They're actually more at risk when they seem to start first getting better, because that initiative and energy come back, but their mood hasn't improved enough to have them be out of danger. So the largest risk of suicide is when mood and energy seem to be improving right after they've been at the deepest, darkest part. Anyone who threatens suicide is at least sending a signal of feeling desperate or hopeless, so it's important that you act upon that and get them help. If somebody has a plan and access to that plan, it's important that you call 911 or tell somebody, a parent, a counselor, a friend, so that they can get the help that they need. Because that is the main risk for suicide, if people have a plan that they can execute and the ability to execute that plan. That's a huge danger signal, and you need to do something. Depression leads to negative thoughts and behaviors, which in turn reinforce depression. Around the world, women's risk of major depression is nearly twice that of men. So you can see everywhere the men are green, the females are red. So you can see it's a much larger risk, and everywhere, even in Taiwan where the rates of depression are pretty low, they're still higher than that of men. Most major depressive episodes end on their own, especially one's first episode. Stressful events often precede depression. Depression is striking earlier in each generation and affecting more people. It wasn't maybe 2 weeks ago that there was a 6th grader at Villa Rica Middle School that committed suicide. That's 11, 12 years old. But that's not the youngest that I heard about. The youngest I know for sure was an 8-year-old that I heard committed suicide. And I think that says something very negative about our culture when an 8-year-old can get to the point in depression where they feel hopeless enough to take their own life. Today's youth, though, do seem more willing to talk openly about depression, which is a positive thing in some ways and a negative in others, because the internet also opens up a whole lot of resources that 8-year-olds and 11-year-olds may not have had in the past about suicide and how to do it, that may lead some of them to act on things that they wouldn't have acted on in the past. There seems to be biological influences for mood disorders. These include genetics. They seem to run in families. If one twin is diagnosed with major depression, there is a 50% chance that the other one will be too, and that increases to a 70% chance for bipolar disorder. The depressed brain, if we look at brain activity, it slows during depression and increases during mania. You can see this brain on the left is in a depressed state, and the activity is a lot of blues and greens with only a little bit of yellow. That is completely switched for the manic state, where the brain has a lot of yellow, not so much green, and then when they go back into a depressed state on the far right, again it's back into the blues and greens, maybe even more severe. It's more blue than it was even in the earlier depressed state.